Well, if you or someone you know suffers from fibromyalgia, then you know how difficult it can be in getting some relief from your pain. Well, our next guest says, you know what, they have a couple of options for you. Mainly, we're talking pain relief here. Dr. Rainer Kremer from AZ Pain Centers is here to tell us really how they go about it. First of all, Dr. Kremer, explain to us, for those of us who don't have fibromyalgia, what is it exactly?
Well, very common among women. It's chronic tissue pain is essentially what it is. It impairs sleep and impairs function. And what it is just a feeling of fatigue, of soreness, of generalized body pains and aches, often mistreated as depression and other issues. But the American College of Rheumatology has determined that there are ways of screening for it because there isn't a specific blood test.
And I hear this from women all the time, is that they have to go through so much before they finally diagnose it. Why is it so difficult to diagnose?
Because it's a condition that really involves inflammation and inflammatory changes within the tissue. And we determined there are 18 points that are screened, and if 11 of those 18 points are positive, it winds up allowing for a diagnosis of fibromyalgia.
Are those the points you're talking about?
Those are the points, and they're in 4 different quadrants on the spine. Now, very treatable, but it's about reducing inflammation and improving function, because with pain comes dysfunction. People aren't moving around physically. What we'd like to see is patients getting back involved in physical activity because it raises endorphins, reduces pain, gets blood flowing, gets tissue flowing.
But beyond that, before you get to that point, you are in so much pain and it is debilitating. How is it that you treat fibromyalgia different than anybody else?
Well, what we do is there are 3 things that we look at. Number 1, what are the pain generators? Is it a joint? Is it a muscle tissue? Is it ligamentous tissue? And we use minimally invasive procedures and techniques to reduce the inflammation. To number 2, get the patient moving again, because this is about reducing pain, finding the pain generators, and then getting them moving. Physical exercise, water consumption, using a trainer, walking, simple things, because some of these things are lost early on. And the third issue is looking at body pH and kind of dietary and lifestyle considerations.
Yeah, what do you mean by that? How do you determine, how does that help?
Well, what happens is we talked about inflammation, that these points are really inflammatory markers that need to be treated specifically with a minimally invasive technique. And the others are a plant-based diet. Plants have wonderful antioxidants in them. Blueberries, greens can reduce inflammatory load, and they also promote an alkaline pH.
And you've actually talked about that before, because it affects so much of our body and our daily life. But real quickly, I want you to tell everybody, AZ Pain Centers, fibromyalgia, tip of the iceberg of the things that you can treat there. Tell me about some of the other areas of our body that you can help us with.
Back pain, knee pain, we do regenerative medicine with stem cells, but we also have a wonderful product called pH Perfect, which if someone doesn't want to go plant-based and wants to use a product, they can use a mineral-based product that will take them from alkaline from acid to an alkaline state and help reduce their pain and their fibromyalgia pain. And we've been very successful. We've done a clinical trial internally and demonstrated great results with it.
Which I think we should be doing anyway for overall good health.
Alkaline is the way to go.
Absolutely. All right, for more information, and that's a great way for you to learn more about the pH test as well, you can visit azpaincenters.com. You can call the number right there on your screen, 480-821-PAIN. That's 7246. And they do accept most insurance plans, and they have locations statewide, including Tucson. Here's the number for Tucson, 520-742-PAIN. That's 7246. And of course, we want to thank AZ Pain Centers. And Dr. Kremer, you are a huge supporter of Phoenix Children's Hospital, and you brought a very nice donation for us this morning. Tell us about that.
Yes, we did. We are very pleased to be of service to the community and also to children, and helping them get back on their journey for recovery. And this is a pleasure. And indeed, we enjoy being here. Well,
we appreciate you partnering with us on that, and thank you so much. That is an amazing donation of $5,000. We thank Arizona Pain Centers, AZ Pain Centers for that. And Dr. Kremer, a pleasure as always.
Thank you.